So hello everyone, myself Dr. Sandeep Dailekar, Professor in Rog Nidan Department, Coordinator of uh, Saturday PIA Teachers Pedagogy Session. Today we have our 55th pedagogy sessions, and today is our resource person is Dr. Janvi Jayant Patarkar Madam. She had done her BMS from Mahaganpati Ayurved Medical College, Dharwad, Karnataka. Her PG in MD Kai Chikitsa from Parul Institute of Ayurved, Faculty of Ayurved, Parul University, Vadodara, Gujarat, and she pursued her PhD from the same institute. She had completed two projects: the clinical trial of evaluation of the efficacy and safety of palsineuron capsule for the treatment of diabetes neuropathy, that is SG Phytopharma Private Limited. As a principal investigator, she had completed this project. The second one project she completed as sorry, to evaluate efficacy and safety of Yasak, that is liquid in the type 2 diabetes. As co-investigator, she had completed more than 10 articles published in various national and international journals. She is a member secretary of AAC community in NBH. She is a she is a NAC member in the criteria 6, HR member, and she is faculty in the cosmetology certificate course in continuous education program Parul University. So this is all regarding to Dr. Janvi Madam. Madam, session is yours. Please start the your lecture with your PPTs, madam.
Okay. Thank you very much, Dailekar sir, for my introduction. Today's my topic is for pedagogy is Ayurvedic perspective on COPD. Myself, Dr. Janvi Patarkar, from Assistant Professor in the Department of Gynecology. We'll discuss about little about the what is mean by COPD, and then we'll discuss about the Ayurvedic perspective. What is meant by COPD? COPD means chronic obstructive pulmonary diseases, which include chronic bronchitis and the emphysema. Here we can see the normal lungs with the trachea, bronchus, bronchial and alveoli. In what happened in the COPD? In the COPD, that narrow bronchus is become narrowed and with the phlegm is present, and emphysema, that is the alveolar part, will be damaged. Definition of COPD: chronic obstruction to airflow due to the chronic bronchitis and or emphysema. Means that is the mainly airflow obstruction is seen in the COPD. Degree of obstruction may be less when the patient is free from respiratory infection and may improve the bronchodilator drugs. And significant obstruction is always present in the COPD cases. Definition of chronic bronchitis: excessive tracheobronchial mucus production sufficient to cause cough and the expectoration for more days of at least 3 months of the year for 2 consecutive years. This is the definition of chronic bronchitis. And the main classification of chronic bronchitis are simple chronic bronchitis, chronic mucociliary bronchitis, chronic bronchitis with obstruction, chronic bronchitis with the obstruction, and the airway hyperactivity. Again, the second part of the COPD is the emphysema. What is meant by emphysema? That is the permanent abnormal distension of the air space distal to terminal bronchi with the destruction of the alveolar spectrum. That means the containing alveolar capillaries and the attachment to the bronchial wall. Again, the classification and the type of emphysema are the centricina, that means the centrilobular emphysema, penicial emphysema, paraseptal emphysema, and the senile emphysema. This picture is showing the symptoms of the both emphysema and the chronic bronchitis. First is the emphysema patient is having the easily fatigueness is nature, frequent respiratory infections, always use the accessory muscles for breathe, Arthropenic is nature. Core pneumonia in the late condition we see the core pulmonary disease in the COPD cases, and the thin in appearance in mainly seen in the, this is the main difference. We can say that the emphysema patient are look like a thin in nature, and while the COPD patient it will look like the fatty in nature. Again, the symptoms of the chronic bronchitis are wheezing, pursued deep breathing, chronic cough, barrel chest, dyspnea, prolonged expiratory time, bronchitis, that means increased sputum, and digital clubbing. These are the symptoms of emphysema and chronic bronchitis. How we can diagnose the COPD in our practice? This is the first is the, we can do the lung or pulmonary function test. This test measure the amount of air you can inhale and the exhale, and whatever the lungs deliver enough oxygen to our blood. During the most common test is called as the spirometry. You blow into the large tube connected to small machine to measure how much air and your lung can hold and how fast you can blow the air out of lungs. And other tests are the 6-minute walk test and the pulse oximetry. Chest X-ray. This is the chest test is not directly we can find any finding in the chest X-ray, but chest X-ray can show emphysema, one of the main cause of the COPD only, and X-ray can also rule out the other lung problem or heart failure, which is the cause for the symptom of COPD. Again, the CT can also same. A CT scan of your lung can help detect emphysema and help determine if might benefit from surgery for COPD. We can say that when any patient is necessary for surgery, then we prefer for the CT also. CT can also be used to screen for the lung cancer also. This is the another diagnostic tool are the arterial blood gas analysis. This blood test measured how well your lungs are bringing oxygen into your blood and the removing carbon dioxide. Again, another laboratory test are lab tests are not used to diagnose COPD, but they may use to determine the cause of your symptoms or rule out other conditions. For example, lab test may be used to determine if you have the genetic disorder called alpha antitrypsin deficiency, which may be the cause of COPD in some people. These tests may be done if you have family history of COPD and develop COPD at young age. This is the picture of spirometry. We can see our many of you seen and done also the spirometry test. This is the measurement, or this is the what we see exactly in that spirometry are FEV1. That means the force expiratory volume in 1 second, force vital capacity, and FEV1 and FVBC ratio. That is the ratio of the force expiratory volume and the force vital capacity. The fourth is the PEFR. That means the peak expiratory flow rate, and the FEF, that is 25 to 70%, means force expiratory flow between 25 to 70% of the vital capacity. You can see here the picture is the female is flowing air to that machine, and we see the report at the computer. That means how we can say that the force expiratory volume in 1 second and the reported in liters and the percentage of predicted. That means 80 to 120% of predicted is the normal FEV1 for our value. This is the standard, again, gold standing system for COPD severity 0, 1, 2, 3, 4. Or description is like at risk, mild, moderate, severe, and very severe. These are based on the FVV measurement in percentage, that is 70%, 80%, below 50%, below 30%, or less than 30% are the severity of mild, moderate, severe, and very severe of the COPD. Again, the classic, these are doing the method by another way also, but they are giving the bronchodilator, and again they done the lung function. This is the classified based on the post bronchodilator lung function. This is the gold 1, 2, 3, 4. That is the mild, moderate, severe, and very severe. These are the standardization gold criteria for the COPD. Again, the modern light treatment for the bronchodilator are the treatment is mainly bronchodilator. They are giving the bronchodilator are short-acting bronchodilator and the long-acting acting bronchodilator by seeing the patient's condition. Bronchodilator relieve the bronchospasm and reduce the airway obstruction by allowing increased oxygen distribution throughout the lungs and improving alveolar ventilation. Again, the drug of choice is the corticosteroids. That corticosteroids are given, they are inhaled or the systemic corticosteroids, oral or intravenous, may useful in the COPD, but are used more frequently in the asthma-like patient. It's very important therapy is oxygen therapy, and in some cases they need to surgical management also. Another important of treatment is COPD and modern is that they are giving the pulmonary rehabilitation. This pulmonary rehabilitation program include exercise training, nutrition advice, and counseling. Here I am showing the one picture which is the in Ayurveda also they are says that the asine labhyate sukha, मतलब कि बैठने के बाद पेशेंट को अच्छा लगता है. तो यहाँ पे उन्होंने कुछ पिक्चर ऐसे दिखाई है जो हमारे COPD पेशेंट को हम एडवाइस करते थे by seeing the which area of lung or which area of the lobe is having the COPD. That is the first we can, for example, we can see that here the upper lobe apical segment patient feel better while the sitting. Like that another pictures are showing, and this is the very good physical pulmonary rehabilitation for patients. Complication, if not you are not treated the COPD patient, then the complication will be see that complications are respiratory insufficiency and the respiratory failure are the major life-threatening complication of COPD. Pneumonia and respiratory infections, right-sided heart failure, pulmonary hypertension, pneumothorax, skeletal muscle dysfunction, depression, and anxiety disorders. Here we can start with our, this is the little bit about the COPD in allopathic perspective. Now we will discuss about the Ayurvedic perspective on COPD. From Ayurveda point of view, COPD can be termed as disorder of pranayama as etiological factors and the clinical features described in Ayurveda classic for pranayama dushti are nearly similar with those of COPD and occurs usually in the prolonged case of Kapha and Vata. In our Ayurveda, they are not directly correlation of the COPD in specific diseases, but Kapha Shwasa Chikitsa we can directly correlate it with the COPD also. And another pranayama Vyadhis also we can correlate with by seeing the signs and symptom of the patient with that directly role with the COPD. Risk factor including exposure to air pollution, secondhand smoke, and the occupational dust and the chemicals, smoking, cold weather, etc., which are also mentioned in Ayurvedic classic. That means the nidana, which is the rajaskama, dhuma, vata, shitambu, sevanat, rukshanna, and vishamashnat. These are the nidanas which are explained for the pranayama vyadhis, which are the main nidanas for or etiological factor of same as the COPD also. Identification, reduction, and the control of risk factor to prevent the onset of COPD are important steps toward the developing strategy for prevention of the COPD. References regarding lifestyle modification. Another view of the COPD, we can say that the Shasa, Kasa, Urakshata, and some point of Rajakshma also we can give the treatment according to by seeing the sign of symptoms from this chikitsa, whatever explained in our Samhitas. Nidanas, that means the positive or etiological factor for COPD are faulty diet and lifestyle pattern from the basis of pathogenesis of any disease as per Ayurveda. Etiological factor of COPD mentioned in classical and modern literature including dietary, food habit, and lifestyle disorder. These are three main etiological factors are diet, food habits, and the lifestyle. First is the diet. That means excessive intake of kidney beans, black gram oil, sesame oil, white flour preparation, curd, unboiled meat, adequate and the marshy or meat or any diet article difficult to digest causing the indigestion. That all are covers from the Kasa and Shasa Nidanas also. The second is the habit, how to take the food. That is the irregular, untimely, that means Vishamashana. Lifestyle, that means exposure to dust, fume, smoke, wind, residing in cold palace and using cold water, reduction, physical exertion or overexertion, daytime sleep, irregular or reverse sleep pattern, other injury to vital organ. That is the one murmur part also. This is the samprapti of COPD. We can say that it is the samprapti of CAS, but the samprapti can correlate with the COPD also. This is the total etiology, pathophysiology of modern is different and our samprapti is different. That's why our drugs are given is for the samprapti vigatan chikitsa. What happen is the mainly in COPD, that is the obstruction of movement of the vata in lower rhythm. That is the pratiloma gati of vata is started and the chalakun of vata is resetted and the moves upward direction. That means the gati of vata is changes that applicates the channels of circulation in the upper part of the body. It takes over the function of udana vayu. That means they again disrupt to udana vayu and then obstruct to prana vayu, that is located in throat and chest and entering all the cavities in the head, fills stem up and causes the hunching and the convulsive movement of body, jaws, sides of neck and eyes. And this means the cuff is formed, bulgum is start to come out, and the obstructed vata causes contraction and stiffness of the eye, back, chest and side of the chest and result to the kapha, that is the main kapha reflex. Samprapti, we can Samprapti Ghanataka of the COPD is same like Kasa and Shwasa. This is the dosha pranamasi vata pradhana tri dosha, dushyar prana and rasa, srotas are prana, srotas, srota dushti prakar, sanga and bimargamana, udbhav sthana is pitta sthana, and vyakta sthana is the Ura Pradesha, that chest region. Sadhya Tatvatar, Yakpen Prutra Sadhya. How can you can manage the COPD by Ayurveda? This is the mainly we can give the timely and seasonal shodhana. It's by seeing the patients, the prakriti and the bala of patient, that we can give the vamana virechana by seasonal and basti. Nirobasti we can give. Nasya also by appropriate seasons. We can give the nasya also. Type of this type of therapies elevate kapha at and may dry up the excess mucus secretion in the pranava srotas. Mainly chronic bronchitis, mainly we can correlate it with the kapha jakasa. That is the kapha jakasa, some formulation we can give in the chronic bronchitis are, that is katfala churna with madhu, then talisadi churna with madhu, prahat lavana with haridra swaras and madhu, rasamanekya with adrak and madhu, samir pannak rasa with adrak and madhu, malapushpa with ghee and madhu, and shinga basma with madhu. These all the medicine will help for the chronic bronchitis. That means the excess cup secretion, we can control the excess cup secretion by giving this medicine. Again we can give the sobhakya with madhu, कंटकारी अवले उद्दुग्ध, अद्रक अवले उद्दुग्ध, हरितगेकी अवले उद्दुग्ध, कनका असव, and we can give them woman also, madanpal majja churna with nimbaswaras also. These all the medicine mainly do the samprati vigatan of kasa mainly, and this will help in the COPD patient by doing the kapagna, vatagna and the vatanulomam properties, which help to reduce the vegas of kasa in COPD patient. Again, this emphysema we can correlate with the Shataja Kasa mainly. Shataja Kasa, we can here use the medicine which are explained in the Urakshata contents, that Shatakshina concept. We can give the emphysema medicine, emphysema can correlated mainly Shataja Kasa. In that, any trauma to patient would occur in which are explained in our Sanhitas, because in emphysema condition we can say that the destruction of the alveoli cycles. We can correlate it with shata or honey to that our alveoli. We can give the medicine like laksha churna with dugdha and sharkara, sitopaladi churna with madhu, chandramitra rasa with madhu, mukta pishti with madhu, vasavle with dugdha, and kushmandavle with dugdha, nagbala prayog we can also do with the rasayan prayog which are explained in the rasayan adhyay, that is nagbala. Dhuma yogya we can give the manashila Duma we can give to that emphysema. Here we can say that the almost drugs are we are sandhana in property, brahmani in property. By we are firstly explained that the emphysema patient is very lean and thin, and they need the brahman chikitsa also with the some deepaniya dravyas also. So we are giving the brahman chikitsa to emphysema by giving the line of treatment like shataja kas. Some patient when the jirna kasa is present, which is the chronic Kapha is present in COPD patient, that time we can give the Lakshmilas Ras with Madhu, Samir Pannag Ras with Madhu, Loknath Ras with Madhu, Suvarna Vasant Malti Ras with Madhu, Sudsekar Ras with Madhu, and Abraka Basma with Madhu, and Praval Pishti with Madhu. This is the line of treatment for the same formula for the COPD. We can give, we can advise to Panchakarma also that COPD patient, but seeing the Bodosha Avastha, Balavala Avastha, Prakurti Avastha, and Sattva of that patient, we can advise the Panchakarma to that COPD patient. Among that Panchakarma, we can give that the Vamana with Madanpala Yog with Madhu Lavana Jala Siddha. We can advise Virechana, that Virechan Kashai or Kapila Churna or Madhu or any other Trivruttavali we can give as a Virechana to that patient. Nirobasti also we can indicated in that COPD patient. We can give the Dashmula Siddha Niro to that patient. Anuvasan we can advise to Erenda Tele Yoga or any other Tel also we can advise for the Niro, that Anuvasana Basti. Snehan we can give Devdaru Tailam Sneha we can use for that patient. Swedan also Upanaha Swedan, Bashma Bashpo Swedan, and one more we can give the Tila Tela plus in the application at Ura Pradesha, which relieve, which help for the Aktam Lavan Tailam, which are explained in our Sanhita. We can advise to that patient and help for the sputum from that COPD patient. Again, we can give the some lepas also in the COPD patient to that relieve the pain or that the accessory muscle which are mostly used for the inhalation and exhalation. We can advise the lepa to relieve the muscle pain also. Some Swedan contradiction of Sweda. When a patient is having the Daha, Pitta Roga, and Raktasravi is there, Atisweda is there, that time we can contraindication for the Swedan also. Nasya we can give at the patient by seeing the seasonal, that is by seeing the season, we can advise the nasya to that patient. At that time, we can give the nasya from the juice of tamlaki, draksha, cow dung, and horse mixed with sugar or equal quantity of jaggery, ginger should be used for the nasya and lehanartha also. These drugs we can ask to patient to nas for do the nasya and for the lehanartha also we can give this same medicine also. At the time severe attack of hiccup and shwas, that is the main severe attack of COPD also we can give the nasya should be administered juice of lashuna, palandu and grinjana and chandana with human milk. We can advise the vegakalin chikitsa also by nasya therapy, and this is with lashuna, palandu, grinjara and chandana with human milk to that patient also. Another nasya is the ghee mixed with sendavalavana juice, alakata along with these pieces of human milk should be given in the form of nasya also. Medicated ghee prepared from Madhur Varga should be given orally in the form of nasya specific hikka shwas very quickly. Here the hikka shwas means we can give the same formula in the COPD also. Dhumapana, that inhale the medicated dhuma is the for help for the pacifying the kapha from the tracheal to bronchitis. This the dose are remaining after administration of Vaman. Mainly we are giving the dhumapana after the Vamana, and that dhuma is very effective in the removing of the kapha from the respiratory tract. The dhumapana with the haridra, root of erenda, laksha, manashila, Jatamasi powder are powdered properly, and wick is prepared, and the wick is simmered with the ghee and used for the medicated smoke. Barley also we can use the barley. The barley should be mixed with ghee and used for the smoking. Cow's horn, hair, ligaments are mixed and used for the smoking. Padmaka, Gugula, Agaru, Shalaka are also used for the Dhumapan. If the some Shamana Aushadhi we can give in the COPD are the Shmula Kwata, Bharangi Kwata, Kanakasava, Shwasakutar Rasa, Vasa Avleha, Ishtimadu Ghanavati, Lavangadi Vati, and Vasa Ghanavati. Some Grutas also explained that the Shamula Gruta, Tejavayadi Gruta, Manashila Gruta, Gruta prepared with Jivaniya Dravyas with three Ushnats, and Vasa Gruta also used. Some formula which I collected from the Charak Samhita for the Kasa and Shwasa we can use in the COPD patient. That some formulas we can use for the COPD patients are formula from Charak Samhita we can use, that is the Pipalyadi Gruta, Treshnadi Gruta, Rasnadi Gruta, Chitrakadi Gruta, Drashamula Gruta, Gudochadi Gruta, and Sarpi Guda. This Gruta preparation which specifies the three doshas, that Vata, Pitta, and Kapha, which will help for the Samprapti Vigatan in the COPD patients. Formulations by Vagbata, we can use the same formulation in COPD patient. Vidakandadi Gruta, Punarnavadi Grita, Kantakari, Jivaniya Grita, Agastya Haritaki, Amrit Prasha Gruta, Dadi Madi Gruta, Nagbala Gruta, Nagbala Kalp also very showing good result in the COPD patient. Vasadi Gruta and Haritaki Leho also used. With the help of medicine, some diet articles are important to maintain the health of that patient, and this is a medicated food article we can advise to that COPD patient, because many times we give advice to patient to eat, do not eat this thing, but patient will always ask what should eat at that condition, and we should give the direct advice to that what should eat that patient. In that, we can advise that patient to prepare the yavagu, which is very beneficial to COPD for the improving his agony, to digest the ama and the anuloman gati of Vata is doing. That is that the yavag, some yavagus here are hingvadi yavagu. The yavagu prepared from hingu, savarchala, ajaji, pida, pushkara, chitraka, and kantakari. Shringi is beneficial in COPD patient. Again, the Dashmuladi Yavagu. Yavagu prepared from Dashamula, Shati, Rasna, Pipali Mula, Pushkara, Karkatakshungi, Amlaki, Brangi, Kuduchi, Nagar, and water are the preparation for the Yavagu. And third is the Pushkaradi Yavag also. We can advise to test patient to eat. And this is the food article which help for the maintaining the lifestyle of that patient. With the yavagu, we can advise to patient to drink yusha also. That is the soup preparation, which is very good in the pani and pachaniya, and feeling the saturated also that patient, and which help for the patient's improvement in the that COPD also. This is the rasnadi yusha, matulungadi yusha, mudga yusha, and yusha prepared from the leaves of kasamarda, Shobhanjana, that is Shiguru, and the dry radish, which are used the excellent result in COPD. We can have some idea for Shwasahara and Kasara Makasha. We can give that Shwasahara, any Shwasahara drugs to that COPD patient. That is the Shati, Pushkarmul, Amla Vetas, Ela, Hingu, Aguru, Suratamlaki, and Jivanti. These are drugs are based in the Kapagna, Sroto Shodhana, Vatanuloman property, and those all are used for the as a bronchodilator. Main thing, Shwasar Makasha is directly correlated. We can correlate these drugs are as the bronchodilator in action. Again, we can use as a Kasahar Masha. Mainly Kasar Mahakasha is the antitussive in nature, that is Draksha, Abhaya Amlaki, Duralaba, Shunkai, Kantakari, Rushchira, Punarnava, Tamla. These are the Shasagna Masakasha. All these are all mainly used as anti-inflammatory, antitussive, and both Kasahara and Shwasahara Mahakasha are mixed. We can use the both Shwasahara and Kasa Mahakasha in the COPD patient. We can give result as an antitussive, bronchodilator, expectorant, immunomodulator, and in Ayurveda we can say the Dipani, Pachani, and the Anuloman in action. These are all our the Shasar and Mahakasha. Patya is very important in COPD patient. Where patient is doing apatya, that is the anidana, and again the disease will aggravate it. The annavarga, shakavarga, phalavarga, dugdhavarga, and paniyavarga, and mansavarga. We can give the COPD patient anna as a shali, goduma, barjara, laja, mudga, and kulat. Shakavarga we can use as a vartaka, bimbi, balamulaka, vastuka, and lashun also we can advise to that patient. Phalavarga, draksha, and dadima is best for the COPD patient. Dugdha is ajak shira. Dugdha is very important. Pani Ushnodaka is very important. Mans is the Jangala Mans is very important to advise. Apatya in Ahara and Vihara. In Ahara, Snigdha, Madhura, Pishchana, Dadi, Paya are the apatya to that patient. Vihara is Dhuma, Diva, Swapna, Maithuni is contraindicated in COPD. Here some formulation with the reference also. There's a कपकेतु सरस ओजीवादी क्वात दशमूल क्वात चित्रक हरित के अवलेह ताम्र भस्म महालक्ष्मी विलास रस and लोकनाथ रस. These are used mainly in the chronic obstructive pulmonary COPD disease. These are the reference. Churna chara so explain are the having the good result in COPD are the Sarpiguda, हरितक्यादि मोदक पिप्पल्यादि गुटिका सीताफलादि चूर्ण तालिसादि चूर्ण व्याघ्र हरितक्यावले. These are the excellent formulation for we can use for the COPD patient. In the form of rasayan is very important to give the line of treatment after every treatment, and that rasayan will give the immunomodulator action and the removing the Khavaguna from Pranavasrutasvadi. That are the Pippali Rasayana, Chamanprash, Agastya Haritaki, Vagri Haritaki, Haridrakhand, Ashwagandha, Guruchi, etc. also can use as the rasayan in the COPD patient. Here I collected some research article which already done the research in the COPD with the help of herbal formulation. In that among rasayan therapy with the classical Agastya Haritaki, 5 grams twice day for 1 month. The inhaler is made for this. In B group, first A group they are given Agastya Haritaki 5 gram, and in B group the control standard medicine COPD is given in same duration. Nebulization also done with the Diolin ml and Deriphyllin retired also. And the herbal aerosol in this study, herbal aerosol and Agastya Haritaki, 2 herbal formulation are used with the control group also. In that herbal aerosol, they are used the Shirisha, Nagarmota, Tulsi, Kantakari. These are the they are made the aerosol form, that inhaler form with this medicine. Among all these drugs, Shirisha is known as anti-allergic, anti-histaminic, antioxidant, anti-inflammatory properties. Kantakari is also known as drug known of its effects on the respiratory system. Nagarmota has anti-inflammatory and antimicrobial property. Tulsi also have antioxidant and antimicrobial property. After seeing the result, we can assume that the compound has bronchodilatory effect along with anti-allergic, anti-inflammatory, microbial effect also. Agastya Haritaki is used for rasayan therapy in the present study, and it is potent drug which is possess the properties help in treatment of respiratory disorder and gastrointestinal elements. In this study, also there is improvement in the condition of patient of COPD with the decrease in sign and symptom after taking the rasayan along with less recurrence. In means we can remember this herbal aerosol which is contains Shirishatoka, Nagarmota, Tulsi and Kantakari Panchanga. This they are made the aerosol of herbal and with the Agastya Haritaki line of treatment. This is the article and I have given already reference. Another article I searched is the Vasadi Kashai in chronic pulmonary diseases. That Vasadi Kashai contain Vasa, Guruchi and Kantakari. We know the Vasa is bronchodilator, immunomodulator, Guruchi is immunomodulator, Dipani and Kantakari is also antitussive in nature. These are showing the good result in the COPD patient. That is the Vasadi Kashai, Vasa, Guruchi and Kantakari. The next article is Vagri Haritikavle in chronic bronchitis. In this study, 66 patients with chronic bronchitis reported that the Vagri Haritikavle effectively reduced the productive cough, which is the cardinal feature of chronic bronchitis. Means in this study, you can say that the chronic productive cough is reduced with the help of Vagri Haritaki. In another study conducted, 25 patients of CASA administration of Vagri Haritaki for 4 weeks showed highly significant result in sign and symptoms. Means if given the long duration, the Vagri Haritaki is also showing the good result in the chronic bronchitis. Some Kasagra Dashimani tablet, whatever I told before the Kasagra Mahakashar, same tablet is made, and in 40 children with Kasa, administration of Kasara Dashmani Vati for 60 days showed the relief in symptoms of gas also. And main important thing is the reduction in the acute eosinophilic count, means the allergic rhinitis, bronchitis we can see in the children's are reduced and showing the good result in ACE and the ESR level also noted. And the decrease in IG level induction, the indicates the drugs are action against allergy. It is found effect in Vata and Pitta dominant cause. This all we can also having the result in the Kasa. This tablet also we can use to that COPD patient, that is the Kasagna Mahakashaya. This is the reference for this study also. Another is this is not directly related to COPD, but it is directly related to anti-tubercular activity. That means Bhringrajasava is the as adjacent to anti-tubercular treatment. Another article is showing Vasadi syrup and the Swasagna Dhuma in the patient, which is also showing the good result in the COPD. In next is the terminal tubulant roxal, that is the Haritaki with the Saindavala. This is the which already we learned in the Rutu Haritaki. Rutu Haritaki can used in the different other medicine also. That is Rutu Haritaki can used in the Saindavala one. In a study conducted 19 patients, Haritaki and Sendavalavan found effective in reducing the symptoms of Kapha. Well, previously I told you that the Kapha we can correlate with the chronic bronchitis. That's why I put this slide here. This we can only plain Haritaki with Sendavalavan to that patient, also giving the symptom, reducing the symptoms in Kapha. There is 92.3 relief in Kapha with sputum and the itching in throat. The action of Haritaki on Vata and Kapha dosha due to its hot flushing observed at the reason behind this efficacy also. And the main is the Haritaki is doing the Vatanoloman action, which can give the result at the Kapha also. Another study of the Lagu Vokshara, an experimental study reported anti-tuskegee activity of root powder of Tribulus terrestris, that is Lagu Vokshara, in sulfur dioxide induced cup model. The number of cup episodes was significantly less in the Lagu Vokshara root administrated group, while root of breath Vokshara was showing significant decrease in number of cup episodes. The study suggests effect of drug in central nervous system and its anti-inflammatory action. That means here we can say that about Gokshura also. Another study is clinically efficacy of two different sample of Shri Shaule in Tamak Shwasa. That is we can correlated Shwasa Chikitsa in COPD also. We can use the Shri Shaule in the COPD patient. Shirish is the mainly antihistaminic in nature. Here the Kantakari, one study of Kantakari also showing the anti-tuskegee activity. The whole plant of the Kantakari showing the significant result in the anti-tuskegee activity when it's compared with the root only. And that means Panchanga is very much having the showing the property of the anti-tuskegee in nature. Administration of 10 gram of powder of drug for 10 days in 30 patients reported better action over the Kapha dominated class. Again, the Kapha class is showing the good result of the only Kantakari churn. Drug might be suppressing the central cup center by stimulating the opioid receptor in the brain. It may be acting through the protective ciliary activity in the respiratory tract, and the action is the demigler can relieve the Kapha. Conclusion. COPD being a chronic progressive disease with irreversible changes need early diagnosis and the proper management. And extra care of diet and diet pattern modification and lifestyle modification with the judicious use of the diet pattern modification and the lifestyle modification with judicious use of the rasayan can help major role in the prevention or the progression of the COPD. Take home message: COPD is the chronic condition that can't yet be cured, but treatment and lifestyle changes can help reduce your symptoms, slow progression, and improve your quality of life. Thank you.
Janvi madam.
Sir.
Yes, this is the so wonderful lecture, and what I say, it covers all the criteria and all the reference, all the articles, all the this knowledge by modern means and Ayurvedic means. So super lecture. I am so impressed. It is so good in its quality. Short time duration, but so wonderful. I am very much impressed with your experience, madam. Thank you so much. I'm asking to the participant if they have any questions, queries, they can able to ask.